Hi PICU staff, grab your popcorn and a beverage of choice and get ready to make a change. Dr. Davey, Dr. Falco, Thomas Lindsay, myself, and a whole multidisciplinary team have been working hard together to improve our daily rounding process. The purpose of our daily rounds is for the safety of PICU patients, their families, and you, the PICU staff. We need to come together each day as a team empowered, respectful, and inclusive to focus on developing a plan of care and daily goals for each and every patient in our PICU. The goals of this reboot of daily rounding is to develop a shared understanding of the purpose of daily rounds, to involve the family in rounds consistently, and to have consistent start times for both the service doc and the resource doc. We want to improve the ownership of the patient by the bedside nurse, shown through your critical thinking skills. We want to improve physician to physician and nurse to nurse handoff each day. We want to limit interruptions by consultants, ideally from 9 a.m. to 12 p.m. We're going to ask that the charge nurse connect with the physicians in the morning and determine the rounding order, and then go back and communicate that with the nurses and the break nurses in order to prevent delays in rounding. As you watch this film, pay particular attention to your role and to the flow of rounds. We will be providing you with a laminated card that will help with the flow. You don't get distracted by the way we're bouncing back and forth between specialties. That will be on that laminated card and easier to follow when you see it. We have purposely chosen a patient example that is a high acuity PICU patient, but not a cardiac patient, to be more inclusive. As we start, Charlene is going to come in and ask the mom, introduce herself, and ask the mom to join us in rounds. We're going to ask that every day the nurse go and ask the family if they want to participate in rounds. And you'll need to explain what rounds is so that they know. And so I will be playing the role of the mom during rounds today. So please get ready, pay attention, and really get excited about this new rounding process. Thank you.
Good morning, Mom. Hi. Hi, good morning. I'm Charlene. I'm going to be Sabrina's nurse today. Great. It's good to see you. So I wanted to let you know in a short bit, Dr. Davey, who is our intensivist, and multiple members of our care team are going to be coming around to discuss our different specialties, and collectively we're going to create a plan for Sabrina's care today. Oh, okay. So with that, we value your insights, and you'll have some opportunities to ask some questions at the end of our discussion. So if you'd like to join us, I'll let you know when they're approaching, and we'll just have you come out with your mask on, and you can join us for our discussion.
Oh, okay, I'd like that.
Yeah, that would be great. Thank you. All right, you're very welcome.
Good morning, everybody. I want to welcome everybody to Rounds. Mom, I'm so glad that you could join us this morning. Charlene's going to start us off.
All right, so we have little Miss Sabrina Phillips. She is 3.8 kilos and on day 11 of her ICU admission. For no overnight events, Dr. Davey, she did get 1 unit of PRBCs last night. She needed a little additional sedation with groaning and being on the VDR, so we did have to go up a little bit, which caused some hypotension, so our epi-drip's been restarted. And then on this morning's chest x-ray, it showed a developing left pneumo. We did have some issues ventilating, so we ended up putting in a chest tube this morning at the start of my shift. So if you don't have any questions with that, we'll start off with Courtney and respiratory.
Hey, Charlene. Sabrina is on day 7 on the VDR ventilator. Her pressures are 24/12. Percussive rate is 500 and her convective rate is 15. FiO2 is 72%. She has a 3.5 ET tube. It's taped at 9.5 at the gum. That's a good placement, and we've got a good lead. She's getting Q4 albuterol and 3% hypertonic saline, BID clomazine. We started fluorinating a couple days ago, and she's tolerating that very well. We're getting minimal secretions. She gets Q6 ABGs, and this morning's ABG was better after the chest tube was placed. and we are getting a daily chest x-ray.
So just in addition to Courtney's comments, our chest tube is at -30 for the pneumothorax. We're proning for 16 hours, supine for 8, doing our big position changes while we have 2 empties on the unit, and we'll alert you when we're going to be turning the patient. Outside of that, I think we can move to cardiovascular if you don't have any questions.
I don't have any recommendations from pharmacy for medications.
For our cardiovascular exam, our heart rates have been in the 120s to 150s, but babies mostly 130s, 140s. Our blood pressures have been 59 to 75, over 33 to 48. Our MAPs have been 36 to 58. So our MAP goal is 45 to 65, so that's where we've seen the hypertension. Our CBPs have been 3 to 4. Our clinical exam, or my clinical exam this morning is much improved based on the report that I got from night shift prior to starting on epi.
Regarding CV med, she's on sildenafil at 0.5 milligrams per kilogram and Q8 hours. That's the low end of the dosing range, but given her blood pressure problems, I'm not sure that we have room to go up. She's also on epinephrine at a rate currently at 0.04 mics per kilogram per minute. She's been up and down, but currently at that rate.
For Lions, we have 2 peripheral IVs. They're both day 10. We have a left femoral art line that's day 5, a right IJ that is day 10, and a neopip that's day 10. On the X-ray, it is showing that this PIC line is not central. So we are managing it as a peripheral line, and we've labeled the line as such. For ins and outs, we ended up -15. Our goal is -50 to +50. It did require 1 PRN diureal dose in addition to our scheduled Lasix. We had a urine output of 5.4 through her Foley, which is now day 4. She's MPO, but on TPN and lipids, and our abdominal circumferences have been anywhere from 34.5 to 35. She had 4 stools, no emesis. On this morning's labs, we did a renal and a MAC. On our renal panel, we did replace potassium, and we did also replace bicarb ×2 and calcium ×1 from our blood gases.
Okay, so diuretic-wise, she's on Lasix 4 milligrams, IV Q6 hours, that's about 1 milligram per kilogram, and aldactazide 2.8 milligrams BID, which is her home medication, and then she got an additional PRN diureal at 4 milligrams per kilogram last night. TPN-wise, she is currently on dextrose 12.5 with 2 grams of amino acid and at 11 mLs per hour and a SMOF of 1 gram per kilo per day. That provides her a calorie count of 53 calories. My recommendation is to go up to 3 grams per kilo of amino acids, dextrose 15%, and lipid 2 grams per kilogram. Also do a little adjustment on the potassium and calcium, so she got extra replacements at the night.
Right, so for nutrition, the goal calories while on TPN is 90 to 108 calories per kilogram per day. I've written macronutrient goals in my note for you both. Eventually, when Sabrina is back on enteral feeds, her goal for catch-up growth will be 115 to 125 calories per kilogram per day.
So for infectious disease and heme, she's been afebrile. So afebrile over the last 24 hours. We did our cultures on the 24th. Her blood cultures remain negative, urine culture is negative, and we are treating with antibiotics for a respiratory culture that came back positive, Klebsiella and Serratia. This morning's labs, we did a CBC and a ProCal. Our hematocrit was 35 after that blood transfusion last night, and our ProCal does seem to be trending down.
So for infectious disease, for the antibiotics, she's on meropenem at 20 milligrams per kilogram, IV Q8, that's day 3, and she's also on azithromycin, 5 milligrams per kilogram, IV daily, and that's day 4 of 5. There is a stop time MMR. I recommend, given that cultures are pan-sensitive for both the Serratia and the Klebsiella, I recommend narrowing the spectrum from meropenem to cefepime and doing a full 7-day therapy.
So for our neuro exam, we did have some increasing sedation needs, as I mentioned, for our overnight events. We are maintaining a train of 3 out of 4 twitches. Pupils are 2. With the titration of drips, we needed some additional boluses. We gave Versed ×6 and Nimbex ×3.
She's on Precedex 1.4 mics per kilo per hour. She's also on Dilaudid 0.004 milligrams per kilogram per hour, which was changed from fentanyl yesterday. There are no PRNs ordered, so I recommend adding a PRN bolus on top of that continuous rate. Her Versed drip is 0.25 milligrams per kilogram per hour, which is a pretty high rate. That might be contributing to her blood pressure issues. She's also on cisatracurium at the 4.5 mics per kilo per hour.
Skin. We are definitely paying special attention to her skin. Skin integrity remains intact. Everything looks really good. We are using Methylex on all of her bony prominences. Staff has been really good about maintaining that. And we're using positioning supports when we're proning. A wound care consult was placed yesterday, and we're expecting to see them today to kind of further advise us and make sure that we're using the proper supports and protection. Mom? Yeah, I know this has probably seemed like quite a lot of information, as Dr. Davies said in the beginning, and we all recognize that Sabrina has a twin that's currently on our pediatric floor as well. So you've done a great job bouncing back and forth and being at the bedside for both of these kids. So we appreciate that as well. And I know you've met with social work, and then we have Child Life here. Tracy, you've met as well.
And Charlene, I had gotten Mom a scent cloth that yesterday, so she brought that back. So I put it at the bedside for you to be able to incorporate into her environment while she continues to rest and heal. And Mom, I'll be checking in with you whether you're at Sabrina's bedside or downstairs with your daughter. I also wanted to come by a little bit later and just talk to you about the other siblings at home and how we can help them during this time.
Okay. I know we've said it several times now, but we do recognize how difficult it is to have two children in the hospital, let alone on different floors. So if there's anything that we can offer you in way of assistance, please let us know. As you know, Sabrina has a lot of things going on, and what we've said is very medical speak. So while this is for the team and for the day approach, I'm happy to answer any questions after I present the plan. From a respiratory standpoint, I'd like to continue to wean the vent. I would like to do ARDS protocol, keeping the pH greater than 7.25 with a PCO2 of 45 to 55. I would like to increase the frequency of our gases to Q4. Charlene, I'd like to increase the pressure from -30 to -20. From a cardiovascular standpoint, I'd like to tighten up the MAP goal to 45 to 55 from 45 to 60. I would like to get the sildenafil on an appropriate dose of 1 per kilo. However, I'd like to get off the epinephrine and be more stable cardiovascularly before we do that. We may not be able to and have to titrate our epinephrine to accommodate that. From an FENGI standpoint, I'm going to change the fluid goal to -50 to -100. I would like to schedule diureal. If scheduled Lasix and diureal does not accomplish our fluid goal, we can talk tomorrow about changing to Vumex or perhaps a Vumex drip. I would like to limit our total fluids. I believe they're currently at 18. I'd like to change them to 15 mils an hour, and if we could concentrate any fluids in order to accomplish that, it will allow us to give more nutrition. In terms of the TPN, I would like to go up on the glucose to D15, amino acids of 3, and lipids of 2 grams per kilo. Angie, what would that make our calories?
The new bag would be 73 calories per kilo.
So that is closer to our lower limit. From an ID heme standpoint, as we said, this respiratory culture was positive for Serratia and Klebsiella. I would like to tighten up the coverage, get rid of meropenem and add cefepime and complete a 7-day course. And as you said, Angie, the azithromycin will complete its course and fall off of the bar. From a neuro standpoint, I want to ensure that we have 3 out of 4 twitches. If the baby is moving and we have no twitches, there is an issue with the trainer floor machine, and please have that investigated. For the Dilaudid, Angie, you're correct. I do want to add boluses, and hopefully that will allow us to decrease the Versed and help our overall blood pressure concerns. In terms of skin and our proning, I want to make sure that we use the donut to accommodate the endotracheal tube, and if you have to cut out a section of it to accommodate that, I would really appreciate that. Mom, I know you probably have questions, and I'd like to address them at this time. Are there some things, specific things you'd like to ask me?
Well, I really would like to hold her, so I'd like to know when I can hold her. And she hasn't eaten, it seems like almost 2 weeks, so I'd really like to know when we can feed her and then when maybe we could go home with her.
Okay, let me address eating first. Currently, she is on what we call TPN and lipids. That is the yellow fluid that's hanging in the bag. That is liquid nutrition. That is the best we can do at this time, and it is providing her the calories she needs almost to fulfill her daily needs. Once we're able to utilize her nasogastric tube, which is in her nose and that goes to her stomach, we can start what we call trophic feeds, and that allows us to start a very small amount that will stimulate the gut lining. We have to be off of blood pressure medications, and we have to be more stable than we are right now in order to do that. Once we're able to do that, and her support, both the endotracheal tube, the ventilator, and blood pressure medications, we'll be able to increase her feeds. Once she's even more improved, we'll be able to remove that tube and allow her to eat by mouth. But we're a ways off from that. And we want it to be safe so she doesn't aspirate again. In terms of going home, that is a good question, and all parents ask me that. We have to be substantially better than we are. We have to be off oxygen. We have to be able to have all the nutritional requirements and fluid requirements that a baby would need in order to go home. And of course, she has to be a lot better than she is right now. So I can't answer you specifically that it'll be exactly 7 days, but my prediction would be somewhere around 2 weeks.
Okay, thank you.
I want to thank everybody for coming to Rounds. It's greatly appreciated.
Thanks for joining us, Mom.